Caring of the patient requiring mechanical ventilation. In the critically ill patient who requires mechanical ventilation, the registered nurse RN and respiratory therapist provide most of the care. Some patients who require chronic mechanical ventilation may be in long-term care settings or at home. In the settings, the registered nurse and respiratory therapist assess the patient and plan and evaluate care, but implementation of some activities may be delegated. Role of nursing personnel. Registered nurse/RN develop plan for communication with the patient who has a tracheostomy or an endotracheal tube. Give sedatives, analgesics, and paralytic drugs as needed. Teach patient and caregiver about mechanical ventilation and meaning procedures. Auscultate breath sounds and respiratory effort, assessing for decreased ventilation and adventurous sounds. Monitor ventilator settings and alarms. Determine need for endotracheal tube suctioning and suction patients as needed. Reposition and secure endotracheal tube based on agency policy. Monitor oxygenation level and signs of respiratory fatigue during weaning procedure. Nursing care of the patient on ventilators. Navdeep Kaur. Observe the physical signs such as color, secretions, breathing pattern, and state of consciousness. Observe the tidal volume and pressure manometer regularly. Intervene when they are abnormal, example, suction. If airway pressure increases, the nurse should continually assess the patient for adequate gas exchange, signs and symptoms of hypoxia, and response to the treatment. Continuous positive pressure ventilation/PPV increases the production of secretions regardless of the patient's underlying conditions. The nurse should assess for the presence of secretions by lung auscultation every 2 to 4 hours. Perform measures to clear the airway of secretions by doing suctioning, chest physiotherapy, frequent position changes, and increased mobility as soon as possible. Maintain humidification of the airway through the ventilator to liquefy secretions so that they are easily removed. Monitor vital signs as directed. Monitor for adequate fluid balance by assessing for the presence of pulmonary edema, calculating daily intake and output, and monitoring daily weights. Maintain oral hygiene frequently in the intubated and compromised patients because oral cavity is a primary source of contamination of the lungs in such patients. Maintain aseptic technique to prevent infection. The nurse should assist a patient whose condition has become stable to get out of bed and to a chair as soon as possible. If the patient cannot move out of the bed, the nurse encourages the patient to perform active range of motion exercises every 6 to 8 hours. If a patient cannot perform these exercises, the nurse performs passive range of motion exercises every 8 hours to prevent contractures and venous stasis. Develop alternative methods of communication for the patient on ventilator such as lip reading, notepad and pencil or magic slate, gesturing, etc. Unlicensed assistive personnel obtain vital signs and report these to the registered nurse. Perform bedside glucose testing, if needed and according to agency policy. Provide personal hygiene, skin care, and oral care as directed by registered nurse. Assist with frequent position changes including ambulation as directed by the registered nurse. Help to perform passive or active range of motion exercises. Measure urine output and report information to registered nurse. Role of other team members. Respiratory therapist auscultate breath sounds and respiratory effort, assisting for decreased ventilation or adventurous sounds. Monitor ventilator settings and alarms. Change ventilator settings as needed or ordered. Maintain appropriate cuff inflation on ET tube. Determine need for ET tube suctioning and function patients as needed. Reposition and secure ET tube based on agency policy. Monitor oxygenation level and signs of respiratory fatigue during weaning. Procedure. Physical/occupational therapist assist with range of motion exercises. Assist with early and progressive ambulation as directed by the registered nurse. Dietitian assess and monitor patient's nutritional status. Recommend formulations for central and/or parenteral nutrition as needed. Speech therapist perform swallowing studies as appropriate. Provide teaching for patient with a long-term tracheostomy.